Welcome to HERcast with Dr. Chito, where we empower women with knowledge and inspiration to lead healthy and vibrant lives. In today's episode, Fearless and Fit, Women Cancer Prevention, we're going to focus on the critical topics of breast and cervical cancer prevention. Now, we are honored, more than honored, to have a very distinguished guest with us today, Her Excellency Dr. Zainab Shinkafi Bagudu. Now, Dr. Zainab Shinkafi Bagudu is a UK-trained consultant pediatrician and a passionate advocate for women's health with a particular focus on cancer. She founded the Medicaid Cancer Foundation, and she is the MD or CEO of Medicaid Radio-Diagnostics Limited, and everybody knows Medicaid here in Abuja, and I believe there are other branches as well. All right, and she did this in 2009 to address the critical need for diagnostic solution in Nigeria's healthcare system. Now, through the Medicaid Cancer Foundation, she creates awareness on health matters, trains health workers, and funds the diagnosis and treatment of cancer patients across Nigeria. Over the past 5 years, the foundation has raised over hundreds of millions, 120 million, more than that actually by now, to support cancer patients. Dr. Bagudu's influence extends globally. As a member of the board of directors of the Union for International Cancer Control, UICC, she plays a vital role in shaping our national cancer policy and serves on the National Control Technical Working Group and the Cancer Treatment Fund. She's also an active member and trustee of FLAC, that's the First Ladies Against Cancer. When she was the First Lady of Kebbi State, Dr. Bagudu had tirelessly championed initiatives to improve the livelihoods of women and children through health, education, and empowerment. Her impact in that state cannot be even stated here. Her special interests include gender-based violence, drug abuse, maternal and neonatal health, girl-child education, and cancer. She's a longtime advocate for women's rights, and she has dedicated her career to promoting gender equality and women's empowerment. So join us as we delve into an insightful discussion with Dr. Zainab Shinkafi Bagudu on preventing cancer in women's health and her tireless efforts to improve health outcomes in Nigeria. This is truly a very interesting episode. Welcome, Dr. Bagudu, to HERcast with Dr. Chito. Finally, I've gotten you here. This is something that this is a good day for me because you're such an advocate for healthcare generally, an advocate for women's health, an advocate for cancer prevention, which is a major issue in our climate, and you're just globally impactful. So I'm so glad that I've gotten you here, and it's such an honor to have you with me here to discuss this topic. So I know you're the pro. So where are we starting from?
Thank you so much, Dr. Chito, for this invitation. And first of all, I'd like to say a big congratulations for this podcast, HERcast, that you're championing, that is creating so much awareness over various health topics. And congratulations, it's excellent. I follow the pages. Why don't we start? We're going to talk about breast and cervical cancer, which are the two commonest cancers in women. Globally, breast cancer is the commonest, and in Nigeria, that's the case. So let's talk about the things that we want the women out there to know. Let's talk about awareness and just let it flow.
Definitely. It was one of the things that I really, when I was looking through breast cancer data or stats, to know that, well, for them to know that breast cancer is, like you said, the most common most common female cancer in Nigeria. I think maybe globally, right? And I also noticed that for Nigeria, breast cancer is the most common cause of cancer death that we have among women. And I saw that it had increased a certain percentage. I think I saw 20 something percent in the last few years. So what do you think is happening here? Because that's what people ask, what is happening here, with breast cancer?
So for us to understand what is happening, we have to go back a little bit into the background of cancer, a very complicated disease, very difficult to diagnose, especially in low middle income countries. and multifactorial. There are genetic factors, there are lifestyle factors, diet, and then you have the infectious disease, and of course things in the environment like radiation and other carcinogens that we're seeing increasing amounts of with the climate change and all these things. So the increase and then you have technology on the other side. So the increase has to do with more awareness, the ability to diagnose it, and the fact that these stimulants, especially the man-made ones, are getting higher, they're getting more, and the levels of the carcinogens we have in our environments today is much higher. The type of diets that we're eating is more refined and less of the healthy foods that we're supposed to be. The computer,
Yes.
sedentary lifestyle, less exercise. So all these things are multifactorial, and they're combining to have an increased incidence of cancer.
Because and what would you say in terms of awareness? Because you see, one of the things I've noticed is even among the educated, sometimes we focus a lot on the vulnerable population and their awareness about certain things, but even among the educated and those that could maybe even could afford to do all the necessary screening, you find out that the numbers are still low in terms of coming to do the screening, knowing what breast cancer is about, how to prevent it. The fear is high, which is amazing. They hear cancer and everybody gets afraid and they start looking for supplements and everything else but screening. In terms of that, how do you think we can improve our advocacy, our awareness in all populations, both the educated and the vulnerable?
Well, for the vulnerable population, it's a case of lack of knowledge and they don't have the tools. For the more educated parts of society, it's a choice. They make the choice to believe in this treatment or type of treatment, to go for screening or not to go for screening. So you reach one level. So we have to start from the basics. We have to give them the tools, explain to them what cancer is, about the screening, what causes it, the things that we want them to do and what we want them to avoid. So when we deal with that end of it, then we can also focus on the more enlightened population and work on them to access the screening facilities and all the tools that we have more. In some cases, it's a case of not being available, but like you rightly said, a good proportion of them are actually able to afford screening, and some governments do offer it. For instance, in Kebbi State, there's a statewide screening program, but one of the biggest issues that we had was demand generation for women to access that screening. So as medical professionals, you and I, we focus on, and this is a general thing, it extends beyond medicines to all facets of development, technology, and so on, economics. We focus on the crux of the matter, the science that applies to us. You and I will start a hospital. We will train human capacity to man those hospitals, whether it's in gynecology or in diagnosis or cancer care. We will focus on programs that train scientists and healthcare workers to be able to run that hospital, and so on and so forth, all the elements of it. And that, no doubt, plays a huge role and is a huge part of the issues that we have in accessing care and also addressing the problem. In this case, we're talking about cancer. But if you look at our populations, over half, and I say that with confidence, over half of the issues has to do with sociocultural barriers. Don't address those. So cancer is already stigmatized, like most diseases are. And with that stigmatization, we need to have more advocates, more community-based education at the grassroots so that we can bring that grassroots level up to the treetop.
I was having a conversation with a friend who has not had a mammogram, And she was like maybe 48, right? And has never had a mammogram in her life. And I said to her, I said, oh, you really need a mammogram. You're due for a mammogram. What would it say if you don't have a mammogram, you get something later, and I'm your friend? You do understand? You need to do a mammogram. I know she told me. She said, okay, you guys keep looking. When you find, then you let me know. Why would I want to go and find? It was almost like if I don't look, my life is better. I'm even called. But those that are looking will one day find something. And I said, are you kidding me? We look to find early, so that we're able to manage you, because your survival rate is higher if you find early. It's not about would we find. We're not searching to find. We don't want to find, hopefully. But when we do find early, you survive. I mean, what has your experience been when you're trying to convince people to go ahead, and even in the rural areas, when you're trying to do your advocacy, what has the response been? Like, what do they say? Because that will help other people know if they say it is wrong.
It's similar, but what we have to emphasize, and what we emphasize, is exactly what you said. The earlier you find it, the better. And I guess this is a good point to chip in the story of the Medicaid Cancer Foundation.
Yes.
The Diagnostic Center was started out of something that I felt was missing in my practice, in clinical practice, when I came back from my training. And very quickly in that diagnostic center, we found that a lot of women that were accessing the mammograms and all the other various tests that we had related to the female body were not adequately informed or aware of what they needed to do. And when we make them do it, they would now ask, what next? What next? So navigating and taking them through that whole process. And that's how the foundation grew, and the pillars also grew. So we grew from having just coffee evenings in the facility to going out into the community, to offering some screenings, and then having a big walk to fundraise. The walk wasn't so big to start with. And then we fundraise funds because when they find it, okay, I've screened, I've found it, what do I do? All right, go and treat. I can't afford it. So, and then of course you move to another level, advocacy, working with governments to have better policies and better funding for cancers. So that's just the story of how we grew. So we let them know that early detection is possible and it's better for the outcome. But the most important, this is the point I wanted to make, the most important factor when you're dealing with, at the community level, are patient voices. You and I can go and talk to them and tell them all the signs, or I can go as First Lady with all my sirens and everything. It brings them out. But that's it. They will just look at you with suspicion and think, these people have come with their politics or their medicine or their drama again. But when you have a lived experience narrating the story,
it's more impactful.
No voice as powerful as that of a patient advocate.
I think that's very true. Is someone who has lived through it. My mom actually passed away from cancer in 2015 years. And she was actually doing mammograms. And I think, that kind of shifted the conversation. It's like, if she was doing mammograms, why, right? And, I always tell people that, see, I don't look at the lower percentage of things that are missed, because in medicine, things are missed.
Absolutely.
But the majority of the number of screening that we don't miss is what I try to focus on. And she wasn't even missed, but there are different types of breast cancer. So the most common types are hardly missed per se. And these are the kind of things I discuss, because it kind of shifted my perspective on how I advocated for breast cancer. Like, not only talking about the importance of screening, also telling them about the fact that, yes, some have missed, but I want to make sure that that it's better to screen, because most are not.
Well, I guess
but that's with this is with more of a, I think, a more advanced population. Then in the rural areas, I think I don't do advocacy as like you do per se on breast cancer, but what we see when we do our outreach is late presentations. Late presentation. I think that's where I think your foundation, the Cancer Foundation, is so important. Because I remember reaching out even when I was, I think, in UICC doing a medical outreach, and I found women that were late and I had to give the number. And I used to wonder, how many can they help? And how many more of these foundations do we need, or things that for these women to assess and they couldn't
Yeah.
even afford the government care in the government hospital. And I was like, how? And I looked at her and I said, oh, I can help you here, but cancer treatment is a long term,
Absolutely.
So what do you think you will, in terms of, should I bring this out now? Advice. Because I mean, now I think now that you're in a role to be a special advisor to the minister now on women's health and cancer prevention, where do you think we should go now in improving cancer awareness, all right, and also figuring out how to manage the cases we find, how to raise funds either by partnership or by some kind of other engagement? What's your
I'm just
idea?
smiling at you because you're answering all the questions.
No, I'm not. I'm like, how do we do this? How do we,
exactly
what
how
are the
we do it.
solutions?
Like I said, you go through advocacy and the levels changes. The levels becomes different. You respond to the needs of what you're advocating about, and that's exactly what I've done. When we ask women to screen, I'll repeat it again, and we find the cancer. So what do they do when they can't afford it? We go into partnerships with the drug pharmaceuticals, that the people that are making the drugs that is going to help them. We go into partnerships with the hospitals that are offering radiotherapy. We go to governments to advocate for better policies that will increase budgetary allocation to cancer. Increase. That's how the Cancer Health Fund was started. A group of us came together and said we have to look at catastrophic health conditions, and top of the list for us was cancer. So how do we start a catastrophic health fund specifically for cancer? Years of advocacy going through the National Assembly, to the minister, to the budget people, to try to have a specific budget line for cancer. So you see, my advocacy is now no longer at the grassroots.
Yes.
We're going higher level. And that fund exists today in Nigeria. The initial allocation was 1 billion, out of which maybe about 400 million was used. Why? Because people did not know that it exists. So those women that you see in my hair can access the Cancer Health Fund, but most of them don't know. I agree that most of the cases that we see come in late presentation.
Yes.
But in my 20 years of advocacy, I am seeing the needle moving. We would see stage 4, 3 and 4, but now we even see stage 1 and 2, and the oncologists tell you the same thing. Daily, I get a message on my phone with horrific pictures of women suffering and going through late stages of cancer, especially breast cancer. Those are the really graphic images that we often get presented with. And of course, you will ask, the first thing you say is, where were you? Where have you been when this was coming up? But it's always a late stage presentation. And for those cases, all we advocate for is palliative care.
Yes.
Support them so that they can have the end of life care and die with some
dignity.
So that is another aspect that we work with. So partnerships, we were talking about the partnerships and the government advocacy, increased funding. Aside from the awareness, we need to talk to other partners outside sector. There are philanthropic organizations that we can raise funds from. There are high net worth individuals that are not so commonly known and are doing a lot of good work and giving back to society. And then I want to talk a little bit about access programs now. A lot of pharmaceutical companies that manufacture the chemotherapy agents go into partnerships where they offer some sort of discount, and organizations like ours can also raise funds further so that we subsidize. So if you refer a patient to me, what I would prefer to do, we can take 1 million, 2 million and throw at it like the Cancer Health Fund does. But it doesn't solve the problem in the long term. What we need to do is to crush those prices, like we did with HIV.
Yes.
And it was successful, but that was an infectious disease that had a global
implication. Yes.
But cancer is not that as much seen, but it is the fastest growing non-communicable disease that we have today in the world.
Yeah.
So we have to. So those access programs offer us the opportunity to be able to say, instead of 100,000 naira, you can access this drug at 50, at 40, at 60, depending on how much funds we're able to raise to subsidize it. The government has such a program. Foundations like ours have such a program. We started such a program in Kebbi State, where these are access programs that patients are able to.
I wonder how they can get this information, because I think, or how even healthcare providers can get this information, because I get being the first line.
We have to do more in terms of creating that awareness. So a lot of times what I just do is send that link. But how many people have access to me out of the 100,000 that we're diagnosing every year, which is really underrepresented? But we need to do more advocacy and more awareness in this case about the existence, those programs. Right now, there's about 230 million. Yeah, how many patients will it treat? But it will save some lives.
Each life matters. So I think
they do access it. And when they do, they're so grateful and happy, and it solves some problems along the line. So we can do more in terms of creating that awareness. As you said, I will work with the minister and the Ministry of Health to make sure that those type of programs are more reachable by the general population. And
that's very important.
They have the platform, they have the ability to, and they can disseminate that kind of useful information.
That's very important. Let me pause here just for those wondering what we say when we say breast cancer screening. Some will say, what does that mean? Breast cancer screening are really preventive measures, right? Where we will check and do something kind of examinations or diagnostic testing to make sure we can catch anything early. Most preventive health is about catching things early. So most times below the age, and you see, and what I'm going to say now, I will just say straight up, I'm reading the American College of Obstetrics and Gynecology, but many countries around the world have different guidelines, right? So normally below the age of 40, we recommend more of clinical breast exams. But as she knows also, we also try to promote what we call self-breast exams. And that's learning, and now everything's on YouTube, I will not lie. Learning how to examine yourself and know your breast is very, very important. And then we now talk about clinical breast exams, where we promote wellness visits. So yearly, your experienced doctor in this field should be able to examine your breast carefully to make sure they don't feel anything, okay, proper exam. And then we come to mammogram. Okay, now the mammogram, I call it like an x-ray of your breast, and it can detect different changes that allows us to see whether anything looks suspicious. See, screening is more of a beginning thing. So we look at, is anything suspicious that will prompt us to do something further. And and I want to say something about mammograms. Now, mammograms usually are, I would say, about 50-60% good. So that means good in the sense that if they see something, they'll say they see it and they actually saw something. And that's why I call it good. But sometimes they could see something and it's not anything at all, and that's what we call a false positive. Or sometimes they don't see anything and there's something there, and that's what we call a false negative. Now, the great thing about it, one of the things that we look at is the fact that we look at how dense your breast is and add other kinds of diagnostic studies to that, like ultrasound sometimes, and if you go further up, some people do an MRI, depending on your history and depending on how thick your breast is. Because some people have what we call fatty breasts, where it's pretty much clear in the x-ray. Some people have very dense breasts where things could hide behind it. And then one of the things I will say Dr. Bagudu did for our country is that Medicaid is one of the only ones that have what we call the 3D mammogram. The 3D mammogram gives you a better view of the lesion, because it takes it I'm not a radiologist, so I'm not going into details, but it takes it in a manner that gives you a very clear picture, full view, that helps especially in people that have dense breasts, and gets you to see the lesion. So one of the things we always say about screening is that for us, we start our screening by the age of 40. Some countries have shifted upwards to 45 and above. Some have shifted to 50, but I continue to use 40 according to the American College of Obstetrics and Gynecology. So that's where I always propose that people start to have mammograms. But again, if you start at 45, is not necessarily a bad thing as far as you're doing proper clinical breast examination. Tell me about this trying to get the 3D and what prompted you to try and get the 3D mammogram to Medicaid.
First of all, it's the mammogram is not it's not an easily accessible diagnostic tool for most people in low middle income countries. And you find that those that can afford it sometimes have to travel abroad to get it. So, and then also it gives you the best, like you said, the best view that you can get from technology at that point before you add on the other tests. So why don't we do that? However, I am a very, very strong advocate of using what you have available.
Yes.
Do what you can. So we have ultrasounds. Nowadays, there are portable ultrasounds available. And whilst the American College advocates for an age limit, 40, we see it tends to happen. Our lifespan, the lifetime expectancy of the average African woman is not as
long as the US. Yes. Yes.
So you would see such diseases happening either earlier or you don't see them at all. There are now portable ultrasounds available that we can take into the communities, and it will help us and give us more diagnosis. You look at the statistics which you mentioned in the beginning, and a lot of women are probably dying undiagnosed in Africa and other low middle income countries because of the paucity of these more advanced diagnostic tools. But if we have just once in a while, we have the opportunity to provide those tools or to allow women to be diagnosed better, then why not? So we didn't start. We started with an analog mammo, which I still prefer, by the way.
Why? The 3D is less painful.
Well, that one was a workhorse, and we could get through 100 women in a day with it, and it won't break down. But the more
technical things, I think, according to the climb.
So you have to treat it gently.
You're reversing medical tourism. You're reversing medical tourism.
We're reversing and that is one of the main aims of the Medicaid Diagnostics Center, to help in
medical trends. So one of the, I don't know where we're at in time, but I want to ask, what kind of lifestyle changes do you think women should make to reduce their risk of developing breast cancer? And I'm saying this because people are taking a whole lot of stuff in the name of reducing breast.
Supplements are okay. Everything is okay, but do it in moderation. If you're going to take supplements, then do the normal multivitamins and things that have been tried and tested and subjected to clinical trials and we know are safe. There are lots of alternative medicines out there that have not been tested on any population and certainly not on the Black population. So we need to be careful. We need to try to do more exercise, not just walking around the house, or because you go to work, you think you have done some exercise today. More exercise, what we eat, the kind of food we put into our bodies, less red meat, less refined food. Even the rice that we use, such a staple factor of food in Nigeria, it's refined. Our local rice is more nutritious and healthier for long-term health. So we have to avoid smoking, we have to avoid taking drugs, we have to say no to drugs, and then we have to also avoid alcohol. These are all very well-known factors that cause cancer, all cancers, and specifically breast cancer. Also, breastfeeding. There are protective factors like breastfeeding. Breastfeeding is a very good protective factor, so we encourage women to breastfeed their babies. Aside from the effects it has on family planning and spacing, it also helps to protect against breast cancer. So a very important one there.
That's a good tip for adding like advantage to why breastfeeding is so important. And women, stop worrying about your sagging breasts. Breastfeed. Your breast will not sag actually. That's, I think, more of a myth. Another thing I'm going to point out from what you said is lifestyle modification. Is people don't know that if you're physically active, I always tell people, if you exercise in like a moderate amount in a week, you can reduce your risk for cancer by a third, they say. And that's why we fight against obesity, because obesity could increase your risk of cancer. So having a normal body mass index or weight is very important also in decreasing your thing, especially after menopause. May I add? We got to be more careful after menopause. So I just going to add that as well. Now we're coming to the end of this part one of our. Give me your last word. Like you have a message. Let's say we're in front of you. There are all these women looking at you, and you want to give them this powerful last word. What will you tell them?
I want my sisters, daughters, mothers to know to stop thinking about cancer as a killer. It is not necessarily so. What kills us is the fact that we find it late. The earlier cancer, especially breast cancer, is detected, the higher the chances of survival. So the one thing I want you to take away from our conversation today is that every month, make a resolution. Tell yourself that you are going to do a self-breast examination. The steps to that are very easily available on the internet and YouTube. You don't even need any formal steps. Just feel your boobies, like they say. Feel your breasts, feel your underarms. You're looking for a lump. If you don't know what you're looking for, don't worry. Feel. If you feel this month, you know what it feels like. You feel next month and you find something that wasn't there last month, go and see the doctor. Early detection is key
in saving lives. Thank you for joining us on this enlightening episode of HERcast with Dr. Chito, featuring the inspiring Dr. Zainab Shinkafi Bagudu. We've had an incredible discussion on breast cancer prevention, and we are grateful for Dr. Bagudu's valuable insights and dedication to improving women's health. As we wrap up part one, we'd like to inform you that our conversation does not end here. Next week, we're going to delve in deeper into cervical cancer prevention, emphasizing that cervical cancer is the most preventable cancer with early detection and regular screening. So next week together, we're going to explore more on how we can bridge this gap in cervical cancer prevention and improve health outcomes for women in Nigeria and beyond. Remember, if you missed any part of our discussion, you can catch the full episode on our YouTube channel, HERcast with Dr. Chito. For the latest updates, follow us on Instagram at HERcast Podcast and at Dr. Chito N. And don't forget to tune into Rapid TV channel on Star Times, channel 176, on Saturday at 7 p.m. and Sunday at 2 p.m. Thank you for tuning in to HERcast with Dr. Chito, a podcast and TV show dedicated to lending women a voice, empowering them with knowledge, and creating a support network that encourages boldness and the pursuit of dreams. Now, let me tell you about what HERcast is really about. It's more than just a show where I sit here to talk to guests. It's a movement rooted in the belief that gender equity will transform the world. Take care and stay healthy till I see you next week.